My name is Melanie Elloy. This presentation will be based on a patient called Mr. Burgess, who has recently been diagnosed with adult-onset schizophrenia. Mr. Burgess is a 32-year-old male who enjoys sports and is active. He takes pride in his appearance and health. Mr. Burgess has no medical or family history of heart, diabetes, or respiratory complications, and is on no current medication. This is the first time Mr. Burgess has been diagnosed and received any mental health help or had a medication care plan put in place. The interview will educate Mr. Burgess on his new psychotropic medication, olanzapine. Topics that will be discussed will include the drug's mechanism, indication, precautions, interaction, adverse side effects, and the dosage his doctor has prescribed him, as well as other dosages and routes options for olanzapine in the future. By the end of this interview, Mr. Burgess will be able to articulate 2 learning outcomes by the end of the interview of why he needs to not suddenly stop taking olanzapine and the importance of keeping the dose regular rather than taking it after or before an episode of psychosis. Thank you. Hello, Mr. Burgess. My name is Melanie. I'm a registered nurse here at the Townsville Health Clinic. How are you today?
I am really good, but I do have some concerns about my new diagnosis of schizophrenia and the medication that I'll be taking. Other than that, feeling really good about everything.
That's good. Now, do you prefer to be called Mr. Burgess or something else?
I go by Ben.
Okay, wonderful, Ben. Do you know why you've come to see me today?
Just to get some education surrounding my new diagnosis and the medication that I'll be taking, just to learn a little bit about that.
That's correct. We'll be going over the newly prescribed medication olanzapine that your doctor has prescribed you. Before we begin, as today may feel a little overwhelming, there will be a lot of information to take in. Is there a method you like to use to try and remember important information I'll be sharing? This may be writing it down, the information yourself, or I can give you some information I've already printed off, highlighted and written on the page to what each area means. Does this sound something you would like?
Yeah, I would love a pamphlet printout.
If you have any questions, please don't hesitate to ask at any time. Okay, Ben, I'll start with the drug's mechanism, which means how the drug works. Olanzapine works by blocking some dopamine receptors in the brain, correcting the overproduction of dopamine. Dopamine is the molecule in your brain that gives you pleasure, satisfaction, and motivation. However, an overproduction of dopamine causes depression, schizophrenia, and psychosis, and can also lead to problems with controlling impulses. This is why olanzapine is effective for persons who exhibit these traits, as it helps balance them out, reducing symptoms. How are you feeling so far? Any questions, or are you happy to continue on to precautions?
I think I'm happy to continue on to precautions.
Precautions and side effects should be considered. Parenteral benzodiazepine is a mild sedation calming drug that should also be taken under medical supervision if necessary while you are on olanzapine. I understand you're not on any medication, is that correct?
Yes, that is correct.
Okay, thank you for that. Now, it is important to remember that these two mixed together can cause your heart to slow down a little bit too much and make you extra sleepy. This is more so than what olanzapine may initially do in the early stages of taking it. Smoking tobacco reduces the drug effects, and drinking alcohol can cause your breathing to become very slow, as olanzapine increases the effects of alcohol, cannabis, and sleeping tablets. So it's best to reduce your intake of these substances. Some more serious side effects to be aware of, Ben, is that you may feel warmer than usual, as olanzapine can affect your body's temperature regulation. Type 2 diabetes is a side effect olanzapine may cause, as it affects the glucose regulation in your body. So you may notice some weight gain, an increase in your cholesterol levels. Olanzapine may cause lowered sex drive, dry mouth, troubles urinating, being constipated, nausea, brain fog, dizziness, and drowsiness. So do not operate any machinery or drive if you are exhibiting these symptoms. Report any symptoms to your doctor so further action can occur. But please do not suddenly stop taking your medication unless directed by your doctor, It is important to regularly take olanzapine because if you stop or take it irregularly, there is a high risk of relapsing and suicide. I know this is a lot to take in. We're almost done. I need to explain the dosage you'll be taking and the other potential routes of olanzapine for now and for future options. Then 2 learning outcomes to take away from today that we've discussed that can benefit your knowledge about your health and the drug olanzapine. How are you feeling about that so far?
It's definitely a lot of information to take in, but I'm feeling pretty good about it.
Okay, that's great, Ben. I'm glad you're following along. Olanzapine comes in oral tablets, injections, such as short-acting and long-acting forms. Your doctor has prescribed you 10 milligram tablets of olanzapine. Take these for a full week. It then would be recommended to book in to see your doctor and report any symptoms you may be feeling. And if needed, your doctor will let you know if the dose needs to be increased or decreased. It is important to know that this drug is to prevent episodes of psychosis. This is why it is important to take olanzapine regularly. Now, before we go on, Ben, is there anything you would like me to explain again or something you don't understand?
I think I'm feeling pretty okay. Maybe if we could just go through when it will start taking effect and how long the effects will.
The response is all the time it takes olanzapine to start taking effect is within 1 to 2 weeks. But for full therapeutic effects, it normally takes 2 to 3 months. Before you leave today, your doctor has requested some blood tests. One will be to check the function of your liver, another to complete a complete blood count to check your components of your blood, and another a blood glucose level test. It has been requested to get your weight to check your BMI, check your blood pressure, and perform an ECG to make sure the dose prescribed is suited for you. Is that okay, Ben?
Yep, that's perfectly fine.
Okay, finally, Ben, I know we have covered a lot of information, but are there 2 key learning points you have gained from today? If so, can you please relay them back to me in your own words?
So the 2 learning goals I came up with while you were speaking was to continue the drug and not suddenly stop as it can relapse or as it can cause relapse or suicide.
Mm-hmm.
And also that olanzapine is a preventative for symptoms of psychosis, and this is why it cannot be taken irregularly or after an episode of psychosis, as it won't work.
That's right, Ben. Those are very important learning points about olanzapine. Yeah, is there anything else?
No, that was awesome. Thank you so much.
Thank you, Ben, and I'll see you next time. Hi, Mr. Burgess. My name is Melanie.